back a little bit more.
Oh God.
Okay, next please.
Oh.
Come in.
How are you this morning?
I got a headache. Headache.
You are her relative?
Husband.
Yeah. You give me her name please?
Miriam
Oh, she's
Motilal.
so cool.
And the date of birth?
16th of March 92.
Where do you all live?
Oh gosh.
Alright.
Okay, tell me what is wrong.
She had headache and fever.
Fever,
Right now she was burning up.
fever and
She
headache.
eating like about 2 days now. She eating
I've
at all.
been so
How many
weak.
days now she has the fever?
How long?
Oh
About
gosh, about
since this
3
morning last night.
days.
It real burning up bad.
Okay,
Oh,
and any medication
gosh.
she's on?
All she medication I have here, but here I didn't know everything. I had this scan here.
Alright.
Oh gosh.
Okay, I'm seeing here she did not have a yellow fever vaccine at all.
Oh,
Okay, the doctor will see. Let me take her vitals.
okay. Alright, that's
Oh
back a
gosh.
little bit. Back.
She had any vomiting?
No? You vomited?
Oh. No, I just feel so weak.
Okay, she has a very high temperature as well.
Oh gosh.
Doctor,
Just
what's
put on
the
the
sheet?
sleeve
Yes, the
there.
doctor will see her if she has any other signs or symptoms. Has she been out of the country recently
No,
as well?
nothing like that. Nothing
No?
like that.
Okay. So you can hold on outside and the doctor will see
Outside?
you shortly.
Alright.
Right where you were sitting outside, the doctor will see you
Alright,
shortly.
come.
Okay?
Where we going now?
You're going off outside. Doctor had to see this now.
By the way, you can let her pass some urine
Alright.
and I will check it
Go
as
pass
well.
some.
Yeah,
Yeah.
bring it back and I'll check.
Come.
The washroom is take a right and then a left and you'll see the door here.
Alright.
Hi,
Wash
good
finally.
day. My name is Dr. Adams. So, what's your name?
Motilal.
You are
I see
her
husband.
husband.
Yeah.
Okay. So, first of all, what you coming for?
My head hurting.
Yeah.
My head hurting
She
and
had
I
fever.
have
She had
fever.
fever.
I've been so weak.
She eating since about 2 days now. She eating at
weak.
all at all.
Okay. So, well, we did the pregnancy test and it was negative.
Alright.
So, what we're going to need to do is take some bloods and have that tested to see what's wrong. And also, we see that you're dehydrated and you're not eating anything. So, we're going to start you off on some fluids. And we're going to admit you to the ward because we don't know what's wrong with you and we need to keep you to do some further testing also.
Keep it cheap?
Yes.
So I stay in the ward?
Yes. So,
Oh.
I need to take some
Find
bloods.
out from she ward.
No, we will know what ward yet.
Oh, okay, alright.
I'm going to get clothes on me for you.
Oh gosh.
So, I'm going to take some bloods.
Alright.
So, just look away.
Gosh.
Yeah, you could probably look away.
Do we gonna do?
I'm going to take your bloods.
Some blood?
Yeah.
Oh gosh.
I need to get my gloves.
Oh boy. You had to get that blood?
Yes, we have to do it because we need to see if everything okay. How would we know what's wrong with you? So, I'm just going to take some blood. Okay, you're going to look away because you're going to hurt a little bit. You're just going to feel like a little sting.
She almost done. Alright.
Oh.
Okay. Okay, so we will test the blood and see what's wrong and we'll let you know what's going on. Okay? Okay, so I'll come back in a little while.
Oh gosh, I want to go.
Alright, you just said that to the doctor.
I
One of
want
them
to
had to
go
come and see you just now.
home. Oh
Alright, you can't
gosh.
go yet. You had to see you just now. Alright. I'm going to call one of them.
Oh gosh, look at
Hello?
my
Hi again.
vomit.
You vomited?
Yeah, she ran home just now.
You now started vomit?
Yeah, she just
And I
started
gained
vomiting.
belly pain.
Okay, well, I've seen that the fluid's still going, so that's a good thing. And I will prescribe some gravel for you, right, for the vomitants.
Oh
And
gosh.
I need to take some more bloods
Blood
More
again.
blood?
Yes. I told you yesterday that we have to take some more blood so that we can confirm.
Alright.
Okay, so
Right, you see,
just need.
Good.
Okay.
Oh gosh.
Okay, so just hold it. Right. Okay, so we'll do the bloods and we'll come back and tell you, right?
Alright.
Okay. And I'll make sure the tablets get
Oh
to you.
Alright.
Liz, the patient, Motilal, she came in. Did she have her vaccine for yellow fever?
No, well, I did check her immunization card and I've noticed that she never did have a
She
vaccine.
never had it.
Yeah.
The pregnancy test was negative, and the blood test, it was done, and we have the specific IgM and neutralizing antibodies with a high range in the blood. So I think she may be a case of yellow fever. I mean, thank God she comes so early so that we could get it done.
But
and
actually,
see it.
we never had a case of yellow fever yet.
Yes, I can. I work in here so long. I never see a case of yellow fever here in so long.
Yeah.
Also, the bilirubin in the blood is building up because I mean the percentage is high. It's higher than normal. So I think she might be a case for yellow fever.
Okay.
We have to rule it out of course, but we can do some more blood tests.
Yeah.
We have to ward her. We have to keep her on the ward.
Yeah.
Okay.
That's observation.
So I will go and tell her. Her husband is with her.
Her husband is here with her.
I will tell them that they need to do some more tests.
Okay.
Okay.
Yeah.
Hi again. So the blood test came back, and she might have yellow fever. We don't know as yet. Yes. We don't know as yet.
Again, fever.
So as I said, you will have to go on the ward. We're carrying you to ward 12, female, and you will stay there. We'll run some more tests, and you will also get your treatment. Okay?
So they go up?
They come
Yes.
in she now, or what I have to do?
An attendant will come carry her to the ward. You can go with her, and when she's finished, you can go and get her clothes and thing and come back.
And I'll get to go back up?
And we'll need to take some. Yes, you will. You'll need to take some more bloods during the course of your stay. Okay?
More blood?
Yes.
Alright.
That's it. So the attendant will come and carry you.
Alright, okay.
Okay. What are yellow fever signs and symptoms? After infection with the yellow fever virus, many individuals will experience no clinically apparent manifestations of the disease, while others will go on to develop a mild, self-limiting flu-like illness characterized by the following signs and symptoms: fever, chills, back pain, weakness, loss of appetite, nausea, or vomiting. Most patients with the initial acute phase of the disease improve after approximately 3 to 4 days. However, 15% of patients may enter a second phase of the disease, which typically appears after a short remission of symptoms from the initial phase of the illness. This toxic phase of the disease is more severe, at which time the high fever returns and more organ systems become involved. In addition to the above symptoms, the following symptoms are signs that may also develop: abdominal pain, jaundice, kidney failure, bleeding from the gums, nose, eyes, and stomach, bleeding in the stool, blood in the vomit, confusion, seizures, coma, or even death. There is a mandated reporting to the World Health Organization of all suspected or confirmed yellow fever cases within 24 hours of detection. Cases should also immediately be reported to the local health department. No specific treatment exists for yellow fever, however, supportive care is critical. Severely ill patients should be treated by an intensive care setting. The required management consists of vasoactive medication, fluid resuscitation, ventilator management, and treatment of disseminated intravascular coagulation, hemorrhage, secondary infections, and renal and hepatic dysfunction.
Nurse.
Yes, Miss Motilal.
Nurse, I'm feeling so cold.
No, Miss Motilal, you have the fever, so you can't cover up too much. So
No.
no, Miss Motilal, you have to leave it open a little bit. You have the fever, so you cannot cover
that she has to cover you
Oh
up.
gosh.
You have a note?
Yes.
Can I see it, please?
I'm feeling cool.
Thank you. So, Miss Motila, I've seen here that your bloods came back, the second blood test, and it's positive for yellow fever. So,
Yellow
you
fever?
do indeed have yellow fever. So, we need to treat you. Okay? So, we're going to start you off on some medication, and we're going to continue the fluids, and that's what we'll do for you. And you have any questions or anything, you'll tell the nurse and nurse will let me know. Okay? So nurse, you can start with the medication and stuff. Here you go. Okay.
Okay, so Miss Motila,
Yeah.
remember doctor was saying that you have the yellow fever, right?
Mm-hmm.
Now I'm letting you know that there's no cure for yellow fever. But you how you have the fever and the chills and all that, we're going to treat you for the fever, give you some medication, you have your IV and everything going. So we'll try and make you as comfortable as possible, okay? So we're going to get your medication, I'm going to give you it. If you're having some pain, so the medication will relieve the pain and it will lower the fever, okay?
Okay. Alright,
Okay, so I'm going to get the medication and I'll be back, alright?
Yeah, bring something from it.
Okay.
Hi, Miss Motila.
Oh, hi, doctor.
So, I see you feeling nice.
Yeah,
You feeling better now?
Yeah, the
That's real
fever
good.
thing gone.
You're not vomiting anything anymore and you're eating your food?
Yeah, I just
Okay.
eat some rice.
That's really good.
Yeah.
So you can get to go home then.
Oh, going home.
Okay.
Alright, yeah.
So we'll discharge you, we'll send you home with some medication, just in case.
Okay.
Then you need to continue taking because you know we don't want the virus coming back.
Okay, alright.
And you can call your relative.
Okay, alright,
They'll
yeah,
come
call
pick
my
you up.
husband.
Okay. Bye bye.
Thanks, doctor.
You're welcome.
Oh, it's so nice here.
Oh, thank you.
Alright.
That's our job.
Okay, bye-bye. Come in.
Hi.
Hello, good day.
Good day, Dr. Adam.
Malini?
Can I speak to the microbiologist?
I'm her.
Oh, okay. Well, what happened? We have a patient on the ward and she has yellow fever. And I was wondering if I can get some information on...
Sure.
Yeah.
No problem. Just step into my office.
Okay.
So let me enlighten you about the yellow fever virus. Yellow fever is a viral hemorrhagic fever which strikes an estimated 200,000 persons worldwide each year and causes an estimated 30,000 deaths. It is mainly found in sub-Saharan Africa, South America, and parts of the Caribbean. Yellow fever virus is classified in genus Flavivirus, which is in the family Flaviviridae. The family Flaviviridae contains over 70 related but distinct viruses, most of which are arthropod-borne. Other major pathogens in this classification include dengue viruses and Japanese encephalitis virus. The yellow fever virus is small, 35 to 45 nanometers, and consists of a core containing single-stranded RNA, surrounded by a lipid envelope. The genome has been completely sequenced and found to contain 10,862 nucleotides. The envelope contains a single glycoprotein with type and group-specific antigenic determinants. In 1900, a commission headed by Walter Reed confirmed that the disease was transmitted from human to human by the Aedes aegypti mosquito. The mosquito vector is usually the Aedes aegypti, a domestic mosquito that breeds near houses, with the females preferring to lay eggs in water-collected jars, old tires, gutters, and discarded tin or plastic containers. The virus multiplies in the mosquito vector about 12 to 21 days after biting an infected person or monkey. The mosquito becomes infective and it remains infective for the rest of its life. There are two epidemiologic patterns of yellow fever virus transmission: the urban cycle and the forest cycle, which is also known as the jungle or sylvatic cycle. In the urban pattern, the virus is transmitted by mosquito from infected humans to susceptible humans. In forest pattern of the yellow fever, the main host is the monkey. The forest cycle of transmission among monkeys was not discovered until the 1930s in South America and 1940s in Africa. Most of these mosquitoes live at tops of trees in the forest. However, in Trinidad, the last case of yellow fever was reported way back in 1979. Despite the presence of the disease, human cases of yellow fever virus is rare in Trinidad. Thanks to our operating healthcare facilities, over 90% of the local population in Trinidad has the opportunity to be vaccinated against yellow fever virus. If people are traveling outside of Port of Spain, especially those who visit rural or forested areas, they may be at risk for infection with yellow fever virus, especially if they have not been vaccinated. So I hope this was helpful, and I hope you can use this information to educate others.
Yellow fever virus is a single-stranded RNA virus that belongs to the genus Flavivirus. Vector-borne transmission occurs via the bite of an infected mosquito, primarily Aedes or Haemogogus species. Non-human and human primates are the main reservoirs of the virus, with anthropomorphic human-to-vector-to-human transmission occurring. There are 3 transmission cycles for yellow fever: sylvatic, jungle, intermediate, savanna, and urban. Asymptomatic or clinically inapparent infection is believed to occur in most people infected with yellow fever. For people who develop symptomatic illness, the incubation period is typically 3 to 6 days. The initial illness presents as a nonspecific influenza-like syndrome with sudden onset of fever, chills, headache, backache, nausea, and vomiting. Most patients improve after the initial presentation. After a brief remission of hours to a day, approximately 15% of patients progress to a more serious or toxic form of the disease, characterized by jaundice, hemorrhagic symptoms, and eventually shock and multi-system organ failure. The case-fatality ratio for severe cases with hepatorenal dysfunction is 20 to 50%. The preliminary diagnosis is based on the patient's clinical features, places and dates of travel, and activities. Laboratory diagnosis is best performed by serological assay to detect virus-specific IgM and IgG antibodies, virus isolation or nucleic acid amplification tests performed early in the illness, or yellow fever viral RNA. There are no specific medications to treat yellow fever infections. Treatment is directed at symptomatic relief for life-saving intervention. Rest, fluid, and use of analgesics and antipyretics may relieve symptoms of fever and aching. Care should be taken to avoid certain medications such as aspirin or non-steroidal anti-inflammatory drugs, which may increase the risk for bleeding. Infected people should be protected from further mosquito exposure during the first few days of illness so they do not contribute to the transmission cycle. The best way to prevent mosquito-borne diseases, including yellow fever, is to avoid mosquito bites and vaccination.